Dear audience, welcome to my second progress report. I would like to talk about the progress I made in the past several months since September when I began my PhD journey in the topic of psychodermatological interventions in chronic skin disease. So my name is Genevieve Arany-Lao. I am a fifth-year medical student here at Semmelweis University, as well as a first-year PhD student at the Department of Dermatology. My vision is to decrease the psychological burden in those who are suffering from atopic dermatitis. And in order to do this, I would like to make it my mission to implement psychotherapy as part of the treatment for atopic dermatitis. So I have two ongoing projects, both in the topic of atopic dermatitis, and they are using two different methodologies. So my first project is investigating the efficacy of psychotherapy in the treatment of patients with atopic dermatitis. And this is going to be a systematic review and meta-analysis. So before I move on, I would like to talk about what atopic dermatitis is. So it's one of the most widespread skin diseases worldwide. It affects 10% of adults and 20% of children. The common symptoms of this disease include itching, also scaling, formation of papules, inflammation, and as this disease progresses to its chronic form, it can cause lichenification as well. Currently, the gold standard treatment for this disease is the use of emollients, moisturizers, topical corticosteroids, immunosuppressants, as well as biologics. However, psychotherapy is being looked at as a novel intervention that could be used in treating this disease. The reason for this is that it's been known for quite a while now that atopic dermatitis belongs to a group of diseases that can be exacerbated by stress. And one study showed that up to 70% of patients who had onset of atopic dermatitis symptoms had an emotionally stressful event prior to their onset of symptoms. Therefore, the aim of my study is to define the role of psychotherapy in the treatment of this disease. So the clinical question I would like to ask is whether psychotherapy is effective in treating the atopic dermatitis. We're using the PICO framework to answer this question. The patients are adult patients with psychotherapy or with atopic dermatitis, and the intervention that we will be looking at is psychotherapy alone or as an add-on. And we will be comparing this to the standard of care treatment, as I mentioned previously, and the outcome that we will be interested in is disease activity, which is measured in different scores, such as the SCORAD or the POEM or EASY, which are all developed specifically for atopic dermatitis and are looking at the disease severity. So we are hypothesizing that add-on psychotherapy is superior to simply standard of care treatment alone. And if this is true, then the implications in the clinical setting are that the patients who are suffering from this disease will have improved quality of life, as well as decreased disease activity. So this is the search key that we utilize to conduct a systematic review. There are two domains. The first domain belongs to the disease. The second domain contains all of the psychotherapeutical interventions that we would like to include in our study. We used three databases to conduct the search, and here are the results. So for the flowchart of the selection, we started with about 7,000 articles, and throughout the duplicate removal, as well as the title abstract selection, we ended up with 17 eligible full texts. So for the progress of my first project, we have finished the data extraction and are planning to move on to the risk of bias assessment. So now I would like to move on to my second project, which is going to be an international study investigating the characteristics of psychological interventions in atopic dermatitis. So as I previously mentioned, atopic dermatitis is a prevalent skin disorder. It affects 220 million people globally. And in addition to this, 30% of all dermatological diseases, so the biggest majority of dermatological diseases seen in the clinical setting, is atopic dermatitis. So it should not be surprising when I say that atopic dermatitis holds the #1 place in burden of disease among all the skin disorders. And furthermore, the psychological impact of atopic dermatitis has been well examined. In one study, it states that higher rates of depression as well as anxiety are associated with people who have atopic dermatitis compared to the general population. Therefore, psychotherapy could be an effective treatment for this disease. So in this study, we plan to assess patients who are coming to the dermatology clinic here at Semmelweis University and ask them about whether they have undergone psychotherapy in the past, and if so, the type and duration of the psychotherapy that they received, as well as the skin symptom improvements that they could see during that time. And we plan to also ask a similar questionnaire to the physicians as well. By doing this, we would like to assess the efficacy of psychotherapy in a real-life clinical setting. So again, the clinical question is going to be whether psychotherapy is effective as an add-on treatment. And we are using the PEO framework here. Patients are also patients with atopic dermatitis. The exposure is psychotherapy, and we're looking at changes disease activity, as well as quality of life here. And we hypothesize that psychotherapy will decrease disease activity as well as improved quality of life. If this is true, then the implication of this will be that psychotherapy can be used as part of the treatment for atopic dermatitis. So in summary, I have 2 ongoing projects, both in the topic of atopic dermatitis, investigating the efficacy and characteristics of psychological interventions. I would like to finish my first project by June of this year, and my second project by the spring of next year. Now I would like to finish with a quote from Theodore Roosevelt: "Believe you can, and you're halfway there." Thank you for your attention.
I would like to ask you regarding your first project, what kind of psychological interventions were there, and what do you think, did you see that, is there a specific intervention which is the most common?
Thank you for your question. So there were about 7 types of psychotherapeutical interventions involved in the studies that I included, but the most popular ones were cognitive behavior therapy, habit reversal, stress management, as well as hypnosis. But yeah, I think about half of the studies included cognitive behavioral therapy. So,
regarding your first project, I would like to ask when is the onset of the atopic dermatitis, and why is it prevalent in children?
Okay, thank you for your question. So there are 2 peaks for atopic dermatitis. There's a big peak in childhood, and there's a later peak in late adulthood. But the reason that it's more prevalent, as I mentioned also in the presentation, in children is because, well, there's multiple theories going around. There's not a consensus, but one of the biggest theories is that children have an underdeveloped immune system, and so they're more prone to this type of immune dysregulation and skin barrier malfunctions.
I would like to ask regarding your first project. In your PICO, you mentioned that you compare psychotherapy alone. Does it worth to measure or look for that? Is it psychotherapy enough for treating atopic dermatitis alone?
Thank you for your question. That's actually a really good question because as it turned out, now that I have all the included articles, they're all comparing psychotherapy as an add-on to standard of care treatment, not simply just psychotherapy alone. So yeah, we will see what the effects are of add-on psychotherapy, but I believe that there is gold standard treatment currently for a reason, like they are proven to be effective, and so psychotherapy I think should be used as an add-on, but it's probably will be very good in preventing future flare-ups, as well as maybe decreasing the symptoms through this.
My question is regarding the pediatric part, the very, very young ones. Is there, or did you meet publication on psychotherapy for the parents, for the family?
Yes.
Because if there is a baby, I believe that the cognitive is
yes.
not so much. So how is it? Can you
yes.
tell us?
So as you know, I'm doing it on the adult patients, but actually there are a lot more studies involving children and also parents, and they usually do these studies as parent-child dyads. So they involve not only the just the parent, but the child is also involved in the process. And yeah, they use cognitive behavioral therapy, hypnotherapy, all the same psychotherapeutic interventions, but involving both the parent and the child.
Do you know of other dermatological diseases where psychotherapy might be beneficial?
Yes, I've actually, psoriasis is also being looked at, as well as like acne. And there was an interesting study where they showed that psychotherapy can reduce itching in a lot of like chronic, a lot of skin disease that involve chronic pruritus as well. And also music intervention, so music therapy, was also proven to decrease urticaria in latex allergy. So,
thank you. And regarding the first project, the studies that you showed, yes, were these patients followed up after psychotherapy?
Yes.
And also how many courses of psychotherapy did they get?
Well, the number of psychotherapy sessions were different for each study, but they ranged from about 4 sessions to 20-something sessions, and the usual follow-up time was about 1 year.